without further delay, I will turn things over to Dr. James Black.
All right, well, thank you, and welcome everyone, and I appreciate the opportunity to speak to you today about the preventive care benefits under TRICARE. If we go to the next slide. We're now on slide 2, titled Disclaimer, which I will read. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. Rather than authorized activities such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. Next slide. We're now on slide 3, titled Agenda, which shows what I will be presenting today. I'll give you a few seconds to read that over. All right, we'll move on to the next slide. We're now on slide 4. I believe it's important to understand exactly what preventive care means under TRICARE. Fortunately for us, it is defined in the federal regulations that governs TRICARE, specifically Code of Federal Regulation 199.2, where preventive care is defined as diagnostic or other medical procedures not related directly to a specific illness, injury, or definitive set of symptoms, or obstetrical care, but rather performed as periodic health screening, health assessment, or health maintenance. Next slide. We're now on slide 5, titled TRICARE Prime Options. Now that we understand what preventive care is, we will begin to explore some of the specifics under the various TRICARE health plans. For TRICARE Prime, the first bullet lists the plans under this option. The other 4 bullets on the right give some details about preventive care coverage, such as you can get your preventive services from your primary care manager or other network provider. There's no requirement for referrals or authorization. There's no out-of-pocket costs. It should be noted that for active duty service members, they always need a referral authorization to see a civilian provider for any healthcare services unless it is an emergency situation. Next slide. Now on slide 6, we will begin discussing the TRICARE Select options. As on the previous slide, the first bullet on the left lists the various plans under this option. And as you can see on the bullet on the right, that no referral is necessary and there are no out-of-pocket costs if you use a network provider. Next slide. On slide 7, there are some aspects of preventive care under TRICARE Select worth noting. As we saw in the previous slide, there are no out-of-pocket costs if you use a network provider for all the covered preventive services. If you go to a non-network provider, there are some preventive services you can get with no out-of-pocket costs. These are the cancer screenings listed there, immunizations, and well child visits. For other covered preventive services, there will be cost shares even if the service is obtained at the same time as a no-cost service. For example, if you're seen for colorectal cancer screening and another preventive service is provided, then there will be a cost share for that service. Next slide. We're now on slide 8. An important point that should be emphasized is for TRICARE Prime and Select health plans, a beneficiary isn't required to pay any portion of the cost of covered TRICARE network preventive services, even if the beneficiary's deductible hasn't yet been fulfilled. Next slide. On slide 9, for beneficiaries enrolled in the U.S. Family Health Plan, you can get your preventive services from your primary care manager or TRICARE network provider. Referrals and authorizations are not required, and there are no out-of-pocket costs. For those under this plan, if you want to learn more, please note the website address provided. Next slide. We're now on slide 10, and I will begin discussing some of the enhancements to the preventive care benefit we have been able to achieve. Under the Patient Protection and Affordable Care Act, there are a number of preventive care services that were mandated by this law. Since TRICARE is governed under a separate set of laws, the requirements under the Affordable Care Act did not apply to TRICARE. It was decided to see what options there were that TRICARE could pursue to reduce the disparity. As a result, TRICARE was able to add additional coverage of preventive services that followed the recommendations from the Department of Health and Human Services, U.S. Preventive Services Task Force, and Health Resources and Services Administration. In the next slide, we'll list some of the enhancements. We're now on slide 11. And on this slide and the next three, we'll give examples of some of the enhancements we were able to achieve. First, an annual health promotion and disease prevention exam for all TRICARE Prime and TRICARE Select beneficiaries age 6 and older is covered. For colorectal cancer screening, FDA-approved DNA stool testing is covered. An example of this test would be Cologuard that you may have seen advertised on TV. Also for colorectal cancer screening, CT colonography, also known as virtual colonoscopy, is covered for the criteria listed. For those who may not be familiar with this test, a CT scan is used to examine the large intestine for cancer and polyps instead of using a scope. Excuse me. Next slide. We should now be on slide 12. The age restriction for clinical expressed exams was removed. If your provider ordered the BRCA1 or 2 gene test because you had a high risk for breast cancer, genetic counseling by a TRICARE authorized provider is covered with no cost shares or co-payments. Also, under the laboratory developed test demonstration, the BRCA1 and 2 test can be attained with no cost share or co-payments if coverage guidelines are met. Next slide. On slide 13, the policy language was revised so that annual well-woman preventive office visits are covered with no cost share or co-pays for all female beneficiaries under age 65 and did not have to be associated with a cervical cancer screening. Since cervical cancer screening should be done at least once every 3 years, there was confusion regarding coverage of the annual well-woman exam if a cervical cancer screening was not due. This language will help clear up that confusion. You can find more information about well-woman exams at the website provided at the bottom of the slide. Next slide. This is slide 14. We did remove the age restriction for physical examinations required in connection with school enrollment, but sports physicals are still excluded. We made it clear in policy that various counseling services, such as for depression and intimate partner violence and abuse, are to be provided at no additional cost. Also, intensive behavior counseling is available for individuals that are at an increased risk of sexually transmitted infections. Next slide. We're now on slide 15. Here are some of the enhancements that were previously available to TRICARE Prime at no cost, but now are also available to Select at no cost. The 1 annual prevention exam for beneficiaries 6 and older. The lung cancer screening using low-dose computed tomography, also known as a CT scan, is covered annually for those between 55 and 80 years of age with a 30-pack-year history of smoking, which means one has smoked a pack of cigarettes a day for 30 years, and are currently smoking or have quit within 15 years. There are some limitations, such as haven't smoked in 15 years, or have a condition that limits life expectancy or unwilling to undergo curative lung surgery. The reason for this is one has a disease that is going to drastically shorten their life, or for example, one has lung cancer and for whatever reason elects not to have curative surgery, then there's not much point in undergoing lung cancer screening. Finally, a one-time screening for abdominal aortic aneurysm by ultrasound for men aged 65 to 75 who have ever smoked. The U.S. Preventive Services Task Force found that for women, the current evidence is insufficient to recommend this screening at this time. Next slide. Okay, we're now on slide 16. As we all know, obesity is a problem not only for the military health system, but for the entire country. There are health consequences as a result of being obese, such as high blood pressure, type 2 diabetes, coronary heart disease, stroke, osteoarthritis, among others. For beneficiaries who are obese, intensive behavioral interventions to promote weight loss are covered. This benefit is available for adults who have a BMI of 30 or higher. There are websites where you can calculate your BMI using your height and weight and don't need to figure out the metric system to calculate kilograms per meter squared. For children and adolescents, their BMI value must be greater than 95th percentile. What this means is after the BMI is calculated, it's expressed as a percentile which can be obtained from either a graph or a percentile calculator. These percentiles express a child's BMI relative to other children in the U.S. Again, there are websites available to assist in calculating the BMI in percentile. As you can see, the number of sessions that are covered per year when provided by a TRICARE authorized provider. The last bullet gives some examples of the types of interventions covered, such as guidance regarding diet and activity and lifestyle changes. Again, using a network provider is preferable. Next slide. On slide 17, we will end our briefing by focusing on well child services. Congress created a specific preventive care benefit for this age group between birth and up to age 6. But some of the same provisions apply, such as no referral authorization is needed. For prime beneficiaries, you can get this care from their PCM or other network provider. And there are no out-of-pocket costs if you're using a network provider. This applies to both prime and select. Next slide. For this slide, 18, I will highlight some of the covered services. TRICARE does follow the guidelines of the American Academy of Pediatrics and the Centers for Disease Control and Prevention, commonly known as the CDC. Specifically, TRICARE covers routine newborn care and screenings recommended by the AAP. TRICARE also covers vaccinations as recommended by the CDC. To see what age-appropriate vaccines the CDC recommends, their website is provided. And for this growing and developing population, physical exams and mental health and behavioral assessments are covered. It should be noted these recommended screenings by the AAP are also covered for beneficiaries from age 6 to 21 during their annual health promotion and disease prevention exam. Next slide. Slide 19 continues the list of some of the covered services. The Bright Futures mentioned there is the AAP's recommendations for preventive health care that includes various screenings such as for vision and hearing, physical, mental, and behavioral development, along with physical examinations and procedures such as certain blood tests. Next slide. And on slide 20 are some of the other well child services. The website provided gives a more detailed explanation and a list of covered services under the well child benefit. Next slide. On slide 21 is listed a number of useful websites and also contact information for our regional contractors. For the East region, it's Humana Military. For the West, HealthNet Federal Services. And for overseas, the International SOS Government. The contractors can assist you in answering questions such as whether the provider is network or non-network, or if there are any associated co-pays. Next slide. This completes my briefing, and again, thank you for joining us today, and it's been my pleasure to present this information on preventive care to you.
Okay, at this time, I will read the questions that have come in, and Dr. Black and the other staff will answer them if able to. Okay, the first question reads, does preventative care cover bone density tests and vitamin D tests?
For osteoporosis, and I know that is covered. I don't believe vitamin D, checking your vitamin D level is a covered benefit.
Okay, the next question reads, TRICARE only pays once a year for vision screening, and my doctor agrees this is preventive care, and I should be seen once a year, even if it is out of pocket. Let me see if the next, there was no question.
So go back. I'm sorry, but for osteoporosis screening, It is covered for women for osteoporosis whose fracture risk is equal to or greater than that of a 60-year-old female who has no additional risk factors. But the short answer to the question is yes, that is one of the preventive services that is covered under TRICARE.
Dr. Black, in regard to the question that they just had about the vision screening, for retirees, there is no TRICARE benefit under Select. So as a result, they do have to pay out of pocket for their vision exam.
Okay, thank you.
Okay, thank you.
And Stan, also just to add to that, under TRICARE Prime, for those retirees who have it, they do get a eye exam every 2 years for diabetics. It is annually that can be received as long as it is documented that they are diabetic. They can get that annually under the Prime benefit.
Okay, thank you. The next question reads, I'm currently TRICARE Select. On October 1st, I turn 65 and will become eligible at that time for TRICARE for life. I understand that at the time there are specific Medicare programs I need to enroll in. Can you explain to me when I need to do this and what Medicare program I need to enroll in to be eligible for TRICARE for life? Also, would like to know how this will affect my wife's medical coverage as she will be 58 in October.
When you turn 65, 3 months before you turn 65, you should receive a postcard informing you that you are eligible to sign up for Medicare Part B. By law, you have to purchase, if you are entitled to Medicare Part A, you must purchase Part B in order to maintain your TRICARE eligibility. Once you do that and you become TRICARE for life, Medicare is now your primary payer. TRICARE for life is secondary. So you must follow all Medicare rules on receiving all medically necessary care in order for TRICARE to cost share on any claims for care received. There are some benefits that are covered by Medicare that may not be covered by TRICARE, and that also applies vice versa. There are some services that may be covered by TRICARE but are not covered by Medicare. So the biggest thing to remember is that once you become TRICARE for life, you must follow all Medicare requirements.
This is Francine. Just to answer the first part of your question, Medicare Part A is your entitlement to inpatient services, hospitalization, etc. Medicare Part B is basically when you purchase that, then Medicare will cover outpatient services. There is a Medicare Part C, Medicare Advantage programs that you will pay a premium, and normally then you're getting the benefit, the Medicare basic benefit with some other enhancements through a commercial carrier. And then there is a Medicare Part D, which is drug prescription coverage, which is normally associated with your having some type of purchased Medicare coverage plan. For TRICARE purposes, the TRICARE pharmacy benefit is considered by Medicare to meet the Part D requirement. So you aren't required to purchase Medicare Part. You're not required to have a Medicare Part D program. As Mr. Keller pointed out, you basically have to be entitled to A and purchase B to continue TRICARE. When you become TRICARE for life, your wife can continue based on if she's currently Prime or Select. That will continue until such a time as she becomes Medicare eligible. But I would ask the people asking questions that really isn't preventive care related. So some of these questions we may just say, once we get the question in your email, we'll go ahead and respond that way. So we keep on track with the preventive care focus. Thank you.
Okay, thank you. The next question reads, what is the status of the Fed VIP start date?
Okay, to make it short and trying to stay on track, open season enrollment for that will begin November the 12th through December 10th. You can go to tricare.benfed.com, and that's where you'll find information, and we'll be putting more information out about that. Thanks. Next question, please.
Okay, the next question reads, I obtained a mammogram on 1/29/18 and TRICARE paid the cost of the filing of the 100%, but says that the cost of reading the film by the radiologist is not paid at 100%. Why would you get a mammogram and not be able to get the results? How is this possible? I'm a spouse of a retired Army in the East Region in the Select program.
Under clinical preventive services, the mammogram itself is covered at 0%. If the provider's requiring you to come back for an office visit for the reading of that, normally that is supposed to be considered part of it. But if you sought the preventive care service without a referral from your PCM or just went and got it independently, then yes, somebody does have to interpret that result. And so that would be the radiologist billing for his or her basic services if you sought that mammogram independently.
Okay.
Like
Next
a doctor's
question.
visit. I'm sorry, go ahead.
Was someone else going to add something, or?
Oh, that was me over speaking myself.
Oh, okay. No problem. Next question reads, why aren't travel vaccines considered preventive care and paid by TRICARE?
I believe if you're on, orders to PCS, travel vaccines are covered. But, if you are electing to take a vacation overseas and there are, specific, vaccinations required, then, that's not, necessarily considered a preventive benefit for at least, for the purposes of TRICARE. This is an elective decision to pursue, vacation in this particular location.
And for those that are within the catchment of a military treatment facility, you could check with the immunization clinic at that MTF to see if they carry that immunization and if they will administer it to you.
Okay, thank you. Next question. Does TRICARE have any plans to cover nutrition for help for diabetes? Does TRICARE have any plans to cover nutrition help for diabetes?
Well,
Go ahead, Dr. Black.
Well, I'm trying to, when they say nutrition help, are they, specifically talking about, providing specific, foods, for the beneficiary, like, be, sugar-free or those types of things. If that's the case, then I'm not aware of anything that TRICARE is looking at regarding that. I mean, TRICARE does cover medically necessary foods, in particular situations, like for individuals who have cystic fibrosis and have difficulty with, with a malabsorption, they're not able to absorb, certain nutrients, et cetera, then, TRICARE can cover for medically necessary foods. But for diabetic foods, then, that is not covered, and I'm not aware of any movement to change that.
Okay, thank you. Next question reads, I have TRICARE Select. Do I need to wait a full 365 days between annual well visits? What is the time I must wait and not be charged?
Francine, maybe you can help, but I think there's a sort of a 30-day kind of administrative grace period if, if you, not exactly, if you get there a little, maybe at 11 months, it would still be covered. Is that correct?
Yes, Colonel Black, you are correct that you can go up to 30 days before and 30 days after. Again, it's probably a little bit better to go after if you can, but sometimes people are traveling out of the area and they would want to get that before they travel or whatever they may be doing. And so, yeah, always just call your contractor to confirm that before you seek services.
Okay. Next question reads, how is HP and DP exams different than an annual physical?
Well, an annual physical, can sort of be the same thing. I mean, it's a preventive service. So if an annual physical, you're going in and, and you're talking with your provider, and let's say that, your provider, counsels you about, diet or those types of things. I mean, I think, in my mind, they're somewhat, synonymous, but, for TRICARE to kind of really, define, what this particular visit is for, sort of has the longer, name for it. But I think, that, in general terminology, going in for your annual routine physical examination would be, considered a preventive, annual preventive visit.
Like, for clarification on that, which is not exactly the same because it depends upon what kind of procedural code the provider uses. Oftentimes when they're doing a physical exam, if they've determined that maybe you need a EKG to rule out something or other, because now they're ruling out medical conditions, whereas the health promotion and prevention really covers a lot of the preventive screening that Dr. Black referred to today. So if you're going to go in and have your cholesterol level checked and your blood pressure checked, and they're going to go ahead and maybe give you an immunization while you're there, that is the health promotion prevention. And there are certain codes that, depending upon how the provider submits the claim, will determine whether or not they're billing for a health promotion and preventive visit or if they're billing for a physical exam. Usually you aren't going to the doctor for any particular condition when you're seeking preventive services. You're merely seeking the services. And most of that screening can be done in a provider's office.
Correct. Yes. Yeah. Thank you, Francine. It's you're exactly right.
Okay. Next question reads: will TRICARE cover the new shingles vaccine called Shingrix? It is much more effective than previous shingles vaccine. Also, as of last week, I was told that TRICARE was not covering this vaccine.
Yeah, this is Calvin. The vaccine Shingrix is now a TRICARE covered benefit. The requirements is now age 50 for that particular one versus the Zostavax, which is age 60. So just as the requirements are for, other than the age, the Shingrix is now a covered vaccine.
And what he's alluding to is if you get it in the provider's office, only recently have certain retail pharmacies made it available. So you need to check to see if there is a participating a participating pharmacy in your area. Not all pharmacies have to give it. They basically, when they sign up to be part of the network, they will make that determination whether or not they're going to offer it. But it will be paid if you get it in a provider's office. And then it now would be paid if you go to one of the participating pharmacies.
And this, Jim, and the reason TRICARE covers it is because recently the CDC, made that one of the recommended vaccines. And so once the CDC made that recommendation, then, per TRICARE policy, TRICARE could cover it.
Okay, next question reads: Patient First is a network provider for TRICARE providers. Yet when I went to get immunizations such as flu, shingles, and pneumonia, they wanted to charge me a copay. Also, where can I get a virtual colonoscopy? My PCM only does scope.
I'm not sure we cover virtual colonoscopies yet. Then Care First, you basically went to get I know they're subcontracted under one of the regional contractors, so I can't address as to why they would be charging a copay. Were they part of a pharmacy setup, or were they part of like a minute clinic that you could drop in at or something?
Yeah, so if you can get that question to us, so we can validate on that, because again, if they are a network provider, then they should, and it's a requirement to receive those services without a copay, and they're trying to charge them. We'll have to check with have the region check with the contractor to find out exactly how that's why that is. So if that's one question, you can forward forward to us afterwards, we will send a response on that.
Okay. Next question. Prior to January 1, 2018, an annual physical was covered at 100%, even if done at a non-network provider. We didn't know this had changed when we went in for our regular doctor on January 11th. We did find out there was a problem when we received a bill for service and lab work. It would have been really nice had we been informed of these changes prior to the changes being implemented. 2 to 3 months after the fact is not a good practice. Okay, I thought there was a question in there, but sorry about that. It was just a comment. And let's see. Next question. Is the well women office visit with a PCM or OBGYN?
Yeah, an OBGYN is considered as a primary care manager for women.
Okay. Next question. My PCM. No, wait, let me see. My PCM never heard of an annual health promotion disease prevention covered once a year. Since retired for 17 years, I have never had this. Where do I find out more about this?
I think
I'm sorry, go ahead, Dr. Black.
Well, I was just going to say, the websites that were listed, at the end of the briefing, can provide you more information, but, I defer to my, other experts in the room there if they have additional thoughts.
No, that's exactly what I was getting ready to say. The websites that are provided for you to get more information, as you should get all your information on your benefits, is located on TRICARE.mil. So I would ask that you refer to that website for all information pertaining to your health care benefit.
And the provider themselves can actually contact provider relations with the regional contractor and ask for clarification on what sorts of things clinically would be considered associated with that visit.
And just a FYI to those who may be on the phone and not in the platform, currently on the screen showing are the resources that has all the TRICARE websites and the regional contractors information. So as Dr. Black and the staff mentioned, you can look at those. You can look at that slide to get websites and phone numbers. Next question. How do we get information on the BMI reduction program?
Well, I think the response will sort of be the same as for the last question. That the websites there provide sort of a more detailed explanation of the benefits that are covered. Any other thoughts from our folks in the room?
Right. I think it's a question of, again, your provider, if they're thinking of you qualifying for weight loss surgery, you have to meet those requirements associated with it. And so as a result, where you can get that counseling and how TRICARE can pay for it should be addressed with the provider and with the regional contractor from the beneficiary perspective. Because in order for TRICARE to pay on the claim, you're going to have to prove you meet the requirements for the counseling in order to get the meet the weight loss criteria. Oh wait, I'm sorry, Dr. Black. Can they seek that independently? I apologize. I just misspoke. Under preventive care, when they're seeing a provider then and wanting to get the counseling as referenced under preventive care service, look up. Is there a particular CPT code or something associated with that, or a typical any primary care provider?
Well, right. I mean, I think if they do meet the criteria, then they can have the the behavioral health counseling, and again, who provides that can I think vary. There are some authorized providers that this is an important part of their practice that they have, that they do. So, I think again, it's, it's going to your PCM first and seeing if you meet the criteria, and then, if this, counseling is something that you would wish to pursue, then, I think the contractor can assist in making that happen.
I would also say it would be very wise in this particular instance to make sure that you seek services from a network provider, because they will be held accountable to meeting the requirements of TRICARE, making sure that you meet the BMI, qualifications, making sure the limit is the 12 to 26 visits in a year. So oftentimes advocate that you really seek these type of services from network providers.
Yeah, I guess that's probably the one thing we should really hammer home, is that using the network provider is always the preferred, course of action.
Okay, thank you. Next question, is diabetic foot care considered preventative care?
Well, for diabetics, certainly doing a foot exam is a, standard practice. It's standard of care, and so if you're going in for that particular service, then I would consider that preventive care.
Okay. Is skin cancer screening visits covered under TRICARE Select?
Yes, I mean, skin cancer, screening is covered, and again, with TRICARE Select, if you use a network provider, then there should be no cost shares or copays.
Next question, is there an age limit from starting age to end age for HPV tests? Is it also covered as a screening, and do the providers still need to have the patient sign a waiver?
Let me see. I'll have to actually go to the policy. So HPV, human papillovirus, DNA testing is covered as a cervical cancer screening only when performed in conjunction with a pap smear, and only for women aged 30 and older. I do not see anything regarding a waiver.
Okay. Next question, is there a benefit for routine dermatology screening?
Well, as mentioned previously, and again, I'll try to see if I can see the, skin cancer. So examination of the skin should be performed for individuals with a family or personal history of skin cancer, increased occupational or recreation exposure to sunlight, or clinical evidence of precursor lesions. But again, I would say that, if you're going in for your annual exam, that, again, is probably just a standard practice by your provider that, doing a skin check is kind of, part of the normal preventive exam. But, certainly for those that may be at increased risk, or in occupations that where they work outside a lot, et cetera, that, it will be, specifically covered for that.
This is Francine. I just, as a reminder, there's a difference between screening versus going in, and if they determine that you might have some type of growth that needs to be biopsied or anything like that, that takes it out of the realm of preventive screening and actually gets it into more the medical treatment category. So be aware of that as well.
Okay. Next question. What websites tell specific details on what services are covered as a preventative service?
Yeah, when you go to TRICARE.mil, at the top of the page, you will see something that says what's covered. You can click on that, and in that box, there's a section in there where you can actually type in exactly what you're looking for to see if it's covered. it will come up showing you if it is a covered benefit or if there's any language in there pertaining to that. It will show you what it is. It will show you the coverage limitations of it. And it may also require you to get some additional information on it. But go to the TRICARE.mil page, go under what's covered, and that's where you can quickly find a lot of the things that you are looking for.
But also be aware that we can't put in all the details that might be in our manual and what's the actual policy and the operational and any exclusions and any certain criteria, because otherwise that whole section would be as big as our manuals, which you really wouldn't want to have to look through. That what's covered is really a lot of the basic, a lot of the more common, a lot of the things that oftentimes people are looking for. So if you see it and there are certain restrictions, that's then when you would call your regional contractor. And under the new contracts, there is, if a provider or yourself would have any question about whether or not something would be covered under TRICARE, they can ask for a pre-authorization review. And at that point, the contractor can determine based on the information provided by the provider, the diagnostic codes, the procedural codes, the tests, the whatever, to determine what of that visit would likely be covered under TRICARE. TRICARE can't guarantee payment, though, until that actual claim comes in, and based on what's on that claim determines what services are or aren't covered.
Okay, thank you. Is glaucoma an existing condition to receive a once-a-year paid eye doctor visit under TRICARE Prime Retiree, or is it just diabetes?
Well, with glaucoma, again, you have a diagnosed condition. So anytime you would go in for any type of vision check or whatever, then that would fall more in the medical benefit, not a preventive benefit. I mean, everyone can get the covered preventive vision visit, whether you have diabetes or glaucoma or whatever, you can still get that visit. But any additional visits, would be under the medical benefit and would have possible co-pays, etc.
Okay. If you are still working and have health insurance through work, where does TRICARE fall within this?
If you are a working individual with other health insurance or OHI from your civilian job or whatever, that is your primary insurance. TRICARE is always second payer. So unless you are a recipient of Medicaid, then TRICARE pays first. So what you must do is you must provide that other health insurance information to the regional contractor, because again, that's who pays first. Once they pay, they should, if the crossover is established with TRICARE, once your other health insurance pays, it should be forwarded to TRICARE to pay on if there is anything for TRICARE to pay on. If for any reason it is discovered that you have other health insurance and it was never reported and TRICARE has been paying as primary, now the government has a responsibility to go back and recoup any monies that was paid, and then that would take you to a whole nother situation. So please be sure to report that other health insurance to your contractor, and as well as pharmacy.
Okay. Next question reads, how long does it take for a physician to be accepted as a TRICARE provider? My physician applied in early January and has heard nothing back, nor will any of the area reps return her calls or emails.
That's it's contingent on a number of factors. Right now, as you know, during this transition, there have been a number of new providers coming into the network. So we really can't There is no set timeline. There is no government requirement that it has to be done. It's making sure the appropriate documentation is placed. The contractor has to go in and validate that information. And so during this transition time, the volume of being able to certify providers or make sure that they're authorized, board certified, et cetera, may be taking a little bit longer than usual.
Okay, next question. I'm a spouse with TRICARE Select and have never used my insurance. I scheduled a visit with a new primary care provider requesting a wellness appointment. I was informed I will likely have to schedule a follow-up for the wellness exam since this is my first visit. Will the first appointment require a copay? If so, how much is the copay for outpatient appointments?
They say they would. Go ahead, Dr. Relax.
Well, I was just going to say that if you go in and if you need to come back, to complete the whatever preventative services or evaluations that need to be done, that would it's my understanding that would not incur any kind of copay or cost share. Is that correct, Francine?
Well, the first one is considered an office visit because you're establishing yourself as a new patient with that individual. So that one, yes, you would have a copay, and I'm looking for the cost information right now. But the second one, when you go in and actually have the health visit done, that one would not have an associated cost with it. But as soon as I find the cost information, I will.
But but with that, second visit, if they had to come back for additional visits, for that, for preventive services, the no copay would still apply. Is that correct?
If it was strictly for any type of preventive service care, yes.
Right.
But
okay.
was that Select? Okay, hold on a minute. And it was a retiree?
Let's see. I'm a spouse with TRICARE Select. I've never used my insurance. Doesn't say if. Yeah, it doesn't indicate
if people if they go to tricare.mil/costs, they'll be able to look up that information based on if they're active duty or retiree, if they're Group A or Group B, and if they're Prime or Select. So just being able to answer it off of that information, we would assume it's a retiree if they've never used their health benefit in the civilian sector. So clinical preventive services, but for a regular outpatient visit, for the regular outpatient visit, they would for routine care. This is the supposition, and if people want to go in and check it themselves, then.
Yeah, she said my husband is in the reserves. Her husband is in the reserves.
Then you're using the Select visit if he's enrolled. If you've never used it, it could be you have to be enrolled in the TRICARE program called TRICARE Reserve Select when your sponsor isn't in an active duty status. And as a Group A under Select, primary care visits are $28, specialty care $41. You use a network provider, but you do have to be enrolled in TRICARE Reserve Select if you're an inactive Guard Reserve family member.
And this, Jim, so if they're going in for the first time, this will probably be coded as a new patient evaluation, versus a preventive care benefit. So, yes, that first visit would have would not be the same thing as a preventive care visit.
And that's assuming you're using a network provider. And under Select, you can either use network providers, or if you use a non-network provider, outpatient visits are 25% of the TRICARE allowable charge. So that can vary depending upon where you are located in the country.
Okay, next. Oh, go ahead.
That's all.
Okay. Next question reads, my daughter was born with a condition that required genetic testing. Her doctor recommended that my husband and I also receive testing in order to get a better read on the situation as a whole. he felt this recommendation would fall under preventative care, as it would screen for things that we wouldn't be able to see otherwise. However, TRICARE deemed this family planning and would not allow for us to go through with his recommendation without paying for it ourselves.
Yes, and that's correct. There's a couple of things. One, that TRICARE only covers lab tests that are FDA approved. There's a number of tests, and you may remember in the briefing talking about the laboratory developed test demonstration. And this is where the FDA has used their enforcement discretion. They don't do safety and efficacy evaluation of these laboratory developed tests, which many of them are genetic tests. So from that standpoint, that TRICARE doesn't cover them. But a demonstration was started, and so since the FDA is not evaluating these tests, that that the Defense Health Agency is evaluating the tests for for safety and efficacy. And the test that is currently covered, again, you can go to TRICARE.mil or talk with with your contractor, which gives a list of the of these laboratory developed tests, and most of them are genetic tests, that are covered under the demonstration. Now, again, TRICARE covers healthcare services that are used for to diagnose and treat, and is necessary for the medical management of that condition. Screening to see if if you have a particular genetic mutation, is not really considered medical care, and as far as the preventive side, that unless it's it's been evaluated by the Defense Health Agency as something that can be covered under this demonstration, then it's not covered under the preventive care benefit either.
Okay, thank you. We have, the next question reads, we have TRICARE Standard, retired Army. Do we have to do anything, or are we automatically transferred to TRICARE East Humana? We live in North Carolina.
Okay, so you no longer are TRICARE Standard as of January 1st of this year. If you were TRICARE Standard prior to December 31st of 2017, you automatically converted to TRICARE Select, which was effective January 1st. So the first thing you need to do is check DEERS to make sure you show as TRICARE Select in DEERS and all your information is correct. There was nothing you had to do, as long as you're not trying to go from TRICARE Select to TRICARE Prime. So you should be good to go.
And yes, the East region is your regional contractor. You can also call them to validate that you are Select.
Okay. Next question. This is I guess referring to a previous question for the other health insurance, TRICARE and Medicare. Is that the order for payment when I have all three?
When you are working, your employer is first, Medicare second, TRICARE third, and in that instance, you would have to manually submit claims to TRICARE because Medicare only interfaces with one other insurance plan. When you retire, if you continue to keep you commercial, then it is Medicare first, commercial second, TRICARE third.
Okay, thank you. Next question reads, go ahead.
Stan, just to clarify something on that too, regardless of if you are still working at age 65 or older and Medicare tells you you do not have to purchase Part B until you retire, for TRICARE purposes, to maintain your TRICARE eligibility, you must still purchase Medicare Part B.
If you want TRICARE.
If you want TRICARE, correct.
Okay. Next question, is hormone replacement therapy considered preventative for women?
No.
Okay. Next question, and probably our last question since we are up on the top of the hour. Will there be a difference in the amount of preventative eye care when TRICARE goes to Fed VIP? I cannot find out if I'm still going to be covered for the same amount of preventative eye under TRICARE Prime Retiree, and why would I get vision coverage if I were to get preventative eye care under Fed VIP? Would I lose my preventative eye care under TRICARE Prime Retiree?
Okay, so under TRICARE Prime as a retiree, as we said before, you get an eye exam every 2 years. If you're diabetic, you can get it every year. Once the FedVip becomes available, you still maintain your TRICARE vision benefit. However, what the FedVip, one of the 4 plans they'll offer, you will now have the ability to, you may have the ability now under one of those plans to have eyeglass coverage as well as contact lens coverage. That is not a benefit under TRICARE. So you do not have to purchase one of the plans offered under the FedVip for vision. That is strictly your decision. But again, it will give you a little more of a benefit, especially when it comes to eyeglasses and the coverage for contact lenses.
And for those retirees that don't currently have a vision benefit under TRICARE, they now would. And when you have a vision benefit, it may possibly be when you are researching those plans, it's beyond just the screening that we currently cover under preventive services.
And this is Jim. I think also that depending on the plan, that some of the, the laser surgeries that TRICARE doesn't cover, might be available under these plans too.
Okay. Well, I would like to thank
research is going to be the biggest thing that beneficiaries have to do when the FedVip becomes available, is to go to that site. They're going to have to review the available plans and make a determination what works best for them, and whether they choose to purchase a vision plan or not.
And this is Jim, and I'm a retiree, and I've already, gone to the website and started looking around. So I would encourage others to do the same. The more you know, and the sooner you know it, I think the better off we'll be once the open season starts and you'll have to make a decision.
Okay, I would like to thank Dr. James Black for sharing his invaluable experience and expertise. I would also like to give a special thanks to Francine and Calvin for answering questions. I would also like to thank our attendees for attending and participating in today's webinar. Now, if you find yourself having questions after the webinar is over, or if we were unable to answer your questions today, please contact your regional contractor. Also, many of the answers to questions related to the TRICARE benefit can be found on the TRICARE website at www.tricare.mil. This concludes today's webinar on understanding your TRICARE preventative care benefits. Thank you all and have a great day.